What are the most popular problems after a hair transplant? I will immediately make a separation into planned difficulties and unplanned problems. And the planned ones aren't even so much the problems, but the difficulties you'll have to face after hair transplant. It is quite popular, and it's just moments that you need to pass on the way to the desired goal to get the result. And likewise, the unplanned problems. These are things that one would like to avoid, of course, but depending on one factor or another, it can happen. How can you deal with it or avoid it altogether? That will be in the second video. Please don't forget to subscribe to the channel and share the video. If you have any questions, you can ask directly in the comments under the video. Within the first hour after the video is released, I actively answer all questions that come in the comments. Today, let's talk specifically about routine complications after a hair transplant. The most common problems that can happen after a hair transplant are planned. The first is swelling in the transplant area. Someone swells more, someone swells less, someone practically does without swelling at all after surgery, but it is quite rare. Basically, you should understand that this is a normal experience. I personally recommend not to lie motionless after hair transplantation, as many clinics advise, but to maintain at least minimal body activity together with drinking water. Also avoid poses where all swelling drains towards the side of the face or one of its parts. This can happen more often while working, for example, when you're sitting with your phone like this or your computer like that, or when sleeping on one side or the other, for instance. Be sure to post in the comments what other problems you might be having. And also write in the comments and the questions to ask the real professionals, and I'll do that. Next is skin redness after a hair transplant. It's fairly common after a hair transplant and shows up in different ways. It can last for a long time on some people. On others, it can be unnoticeable after just a few days. There may be an allergic reaction to medications, and inflammatory reaction to tissue damage, improper post-operative care, and in fact, the individual tendency of the skin to redness and its sensitivity. Next is itching, burning, and painfulness. Burning and painful sensations may occur in the first few days after the hair transplant. However, more often it is not. Itching appears on my observations on the 5th, 7th day. This is elementary related to the healing of tissues. Therefore, I recommend washing your hair in the first week twice a day, and before that apply panthenol, which will also soften the crusts, and afterwards apply aloe vera to soften and moisturize them. Do not use oily creams and oily compounds so as not to block oxygen, which is also necessary for healing. If your head itches a lot after a hair transplant, you can scratch it with a brush. It's a little bit of a handy hack from our guys. This is such a brush, for example, which is used to apply makeup or, in general, any available brush. It won't damage the skin after transplanting, but you can scratch it at the same time. Avoid sunlight, rainfall, and strong winds. The next thing is the shock loss of transplanted hair after a period of between 2 to 4 weeks. This is actually a very average period. It happens earlier, it happens later. The next point is an increase in the loss of your own hair. Here, the main thing is to consider the main causes and try to avoid them. The first is stress. Psychological stress can lead to deterioration of hair follicles and cause a temporary increase in your own hair loss. The second is nutritional deficiencies. Improper diet, deficiency of certain vitamins and minerals such as iron, zinc, vitamin D. All of these can affect and contribute to hair loss. The next point is changes in the hormonal background. Hormonal changes such as pregnancy, menopause, or thyroid disorders can affect the hair growth cycle and cause your own hair to fall out, not the hair that is supposed to fall out in a period of shock loss. Medications. Certain medications, including antidepressants, anticoagulants, and arthritis medications, can cause increased hair loss. Well, and of course you should avoid aggressive exposure to hair. Almost all possible questions are already covered in my videos on my main Russian language channel, videos from which I am gradually translating into English. If you don't have time to watch videos, book an individual one-on-one consultation where I will personally analyze your situation and create a plan of action specifically for you. Every case is different, so we will make a plan that will work exactly for you. Plus, a clinic promo code will even make your transplant cheaper. The next point is the formation of crusts at the hair transplant area. This is also a planned experience that you need to be prepared for. Remember that a hair transplant is a surgical procedure, after which a microtrauma is created. Dry blood clot forms a crust. Bacteria can accumulate underneath. That's why it's important to wash your hair. I suggest doing it twice a day for the first week and alternate with softening and moisturizing the crust. Remember that you don't have to tear off the crust, but being on your head for a long time can create a certain problem for graft survival. Uneven growth of transplanted hair. The first is the individual characteristic of hair growth. It may depend on the individual characteristics of each person. For example, some people have faster and denser hair growth than others, regardless of the transplant procedure. Technical aspects of hair transplantation. The quality and accuracy of the hair transplant procedure plays a role, so every time I repeat that it is very important to choose a good doctor and a good clinic, which we always do with you in free general consultations and detailed one-on-one consultations. It is very important to analyze the situation completely. What do you have? What age? What diseases? What dynamics of hair loss? What donor area? And so on. We always consider all this in my detailed consultation one-to-one. We then make a plan based on all of these factors. The third point is the modeling of the front line. The front line is very important in a hair transplant. It's something you have to live with for the rest of your life, and your appearance will depend on it. For some, it doesn't matter, but until you regret not thinking about it earlier. The next thing is choosing the right clinic and the right doctor for your specific case. Because clinics are different from each other, just like doctors can be different from each other in their specifics. Some doctors are very good at covering large and huge areas of baldness. Some doctors emphasize the front line specifically and create those unique front lines that are indistinguishable from heads that have never undergone a hair transplant. Some doctors are great at increasing hair density in areas where you have sparse hair. For each individual case, you need to choose the right clinic and the right doctor who will properly implement our plan, and you'll get your unique result. The original condition of the hair. It is important to remember that the transplanted hair will grow as it would have grown in its original donor area. If the original hair was weak or of fine caliber, the transplanted hair will have similar characteristics. The next thing is care and recovery. Proper care and rehabilitation after the procedure plays an important role in the growth of the transplanted hair. It is important to follow the doctor's recommendations for care and avoid activities that could damage the new hair for the first few weeks after the transplant. Accordingly, for those guys whom I personally lead and who are on my support, I individually tell you on each of the days what you need to do. I track your result on a particular situation, and we take action depending on this or that scenario. Unplanned problems that can happen after a hair transplant. I'll talk about those in a separate video. Thank you for watching this episode to the end. Don't forget that there are 2 episodes about problems after hair transplantation. Be sure to watch the next one. It's more important.